The next vitamin is vitamin B3, nicotinic acid, and nicotinamide. Nicotinic acid and nicotinamide can serve as the dietary source of the cofactor form of vitamin B3. Means these are the active form of vitamin B3, which is basically niacin or nicotinamide. So the two cofactor form are NAD, that is nicotine adenine dinucleotide, and NADP, nicotine adenine dinucleotide phosphate. Both these are the part of more than 400 different enzyme reactions in the body. The highest of all vitamin derived coenzyme. These enzymes help with changing the energy in the carbohydrate, fat, protein into a form the body can use, metabolic processes in the body cell, communication among cell, expression of DNA in the cell during reaction, the reduced form of NAD and NADPH2 are synthesized. NAD can be derived from the amino acid tryptophan, so it is not considered as a true vitamin, but it is a de novo synthesizing vitamin. The synthesis de novo is not efficient because 60 mg of tryptophan are required to synthesize 1 mg of NAD. Daily recommended allowance of this vitamin is 14 to 16 niacin equivalent per day. If there is deficiency of niacin or vitamin B3, it can be identified as pellagra. Pellagra is described as 3Ds: diarrhea, dementia, and dermatitis. So in case of deficiency, brown discoloration on the skin, patches of the skin with rough appearance, a bright red tongue, vomiting, diarrhea, constipation, headache, depression, and fatigues are observed. Now come to next vitamin, that is vitamin B5. Vitamin B5 is a pantothenic acid, or another name is chick antidermatitis factor. It is synthesized by the gut bacteria like all other B vitamin by using pentoic acid, which join with the beta-alanine by a peptide bond. It is a 5-step mechanism and it is converted into a CoASH finally to serve as a cofactor. The main function of vitamin B5 pantothenic acid serve as a component of acyl carrier protein ACP, which is the domain of fatty acid synthase involved in fatty acid synthesis. Pantotheniate is therefore required for the metabolism of carbohydrate via TCA cycle, and all fats and proteins also need vitamin B5 or pantothenic acid as a cofactor. At least 70 different enzymes in the human body are identified which require this vitamin as a cofactor or as a ACP derivative for their function, which are including the same critical thiamine dependent enzyme pyruvate dehydrogenase, 2-oxaloglutaric dehydrogenase, and branch chain alpha keto acid dehydrogenase. In the next slide, you can check the complete structure of CoASH along with the daily requirement. For the adult, daily requirement depends upon the calories intake, just like thiamine. So 5 to 10 milligrams are required for 2500 calories intake. The requirement of this vitamin can increase in case of severe stress, acute illness, burns, severe injury, oral administration of broad spectrum antibiotic in pregnancy, lactation, in growing children, and in convulsions. The next vitamin is vitamin B6. Vitamin B6, having the different name pyridoxine, pyridoxamine, and pyridoxal, which are collectively known as vitamin B6. All three compounds are efficiently converted to the biologically active form of vitamin B6, which is known as pyridoxal phosphate or PLP. This conversion is catalyzed by the ATP requiring enzyme, which is known as pyridoxal kinase. Pyridoxal kinase is a unique in the mechanism that it needs zinc for its full activity, so it is a metallo type of enzyme. If we talk about biochemical role of vitamin B6, it is involved in the synthesis and catabolism of amino acid. Unique point of this vitamin is that it is needed for the synthesis of several neurotransmitters including serotonin, catecholamine, dopamine, norepinephrine, and epinephrine. Along with that, it is also required for the synthesis of GABA, which is an inhibitory neurotransmitter. PLP is required for the synthesis of heme via the enzyme catalyzing the initial and regulated step in this pathway, alpha amino levulonic acid synthase. This is the enzyme which requires PLP for the synthesis of heme. It involved in the methionine and cysteine metabolism. It is also vitamin B6 is also required for the conversion of tryptophan to nicotinamide adenine dinucleotide, which is the vitamin B3. It is required for glycogen homeostasis as a cofactor for glycogen phosphorylase. So glycogen is a stored form of glucose which can make the availability of glucose at the time when it is required, and it is also maintaining a homeostasis to take up excessive amount of glucose to maintain the hyperglycemia and hypoglycemia. The daily recommended allowance or the requirement in the diet is proportional to the level of protein consumption, which are ranging from 1.22 to 1.4 to 2 milligram per day for the normal adult. And once there is a high requirement, especially during pregnancy and lactation, the amount will increases approximately 0.6 milligram per day in the actual daily recommended allowance. The deficiency sign and symptoms can arise when a person is taking an insufficient or imbalanced diet. There is any malabsorption due to the administration of certain drugs, for example, isoniazid and penicillamine. These are the two drugs that can make complex with the pyridoxal as well as its cofactor, that is PLP. So resulting is the deficiency of this vitamin. The main cause of deficiency or the main symptom of deficiency is the seizure disorder, which is related to the reduction in the synthesis of GABA, which is an inhibitory neurotransmitter. The second sign and symptom that arise due to deficiency is the microcytic hyperchromic anemia that are similar to that of iron deficiency and heavy lead poisoning deficiency. The two additional critical enzymes which require PLP are cystathionin beta synthase and cystathionin gamma lyase. These are involved in the metabolism methionine to cysteine. Due to the role of vitamin B6 in this reaction, deficiency in the vitamin can lead to homocysteinemia and homocystinuria due to the resultant blockade in the CVS. So homocysteine is playing vital role in developing cardiovascular disorder. So level of these homocysteine are usually not appearing, or the amount of homocysteine is not appearing in the urine as well as in the blood. Why? Because homocysteine is converted into methionine in the presence of not only vitamin B6 but vitamin 9 as well as vitamin B12. So the deficiency can lead to cause homocystinuria and homocystinemia. The next vitamin is vitamin B7, which is also known as biotin and vitamin H. Manufacturers add biotin to many hair, skin, and nail supplements. Some people believe that biotin may help with the psoriasis, which is a type of skin disease. Biosynthesis and role of biotin. Biotin is the cofactor required for the enzyme that are involved in three main carboxylation or carbon dioxide bearing reactions, including carboxylation, decarboxylation, and transcarboxylation. It is bound to lysine residue in protein, forming a complex that is called biosyntin in the diet. So, in the diet, it is not available as a free, but in terms of biosyntin, which is a protein bound form. In the body or in the GI tract, there is an enzyme biotinidase which need to recycle it for human body. Once it is released from the protein or consumed in the free form, biotin can easily absorb from the lumen of the intestine through the action of sodium dependent vitamin transporter like B6. Biotin cofactor needs for acetyl CoA carboxylase, which is involved or which is the enzyme in fatty acid synthesis. The second enzyme which needs biotin as a cofactor is the pyruvate carboxylase, which is involved in gluconeogenesis. Propionyl CoA carboxylase involved in amino acid, specifically methionine, valine, isoleucine, and threonine, and for the metabolism of and fatty acid oxidation. Another enzyme which needs biotin as a cofactor is the 3-methylcrotonyl CoA carboxylase, which is involved in the metabolism of leucine. Daily recommended allowance of this vitamin is 30 mg per day. Deficiencies are extremely rare because these vitamins, like other vitamin B, can synthesize in the intestinal flora or by the gut flora. Deficiency seen only after long-term antibiotic therapy, excessive consumption of the raw egg, or when the body's requirement or demand is increased, predominantly during pregnancy and lactation. As far as excessive consumption of raw egg white is concerned, raw egg white containing a protein avidin. This involves as a biotin preventing intestinal absorption. Inherited disorder in which biotinidase is deficient in certain condition, so that may lead to cause biotin deficiency. So these are the certain factors which can be responsible for biotin deficiency, including malabsorption or any problem related with the GI tract. The most common sign and symptom of deficiency including thinning of the hair and brittle nails, depression, fatigue, a scaly rash around the eye, nose, and mouth. So this is all about vitamin B3, B5, 6, and 7. The next vitamin will be B9.